Good morning, everybody. Thank you for being here for the September task force meeting. I expect that in the week since our August meeting, particularly with the marking of International Overdose Awareness Day on August 31st, that there's been some reflection on people's parts as we've talked about the numbers and the work that we're doing. Okay. And a renewed commitment. I know last week I was at Newton Wellesley Hospital for the Purple Flag ceremony, which they bravely carried through with despite the pouring rain. And the purple flags that if you've had the occasion to drive by Newton Wellesley or were arrayed on the grass outside, one for every Massachusetts resident who lost their life to an overdose over the past year are really incredibly compelling. And again, as we talk about all the time, it's not just that person who's represented by that flag, it's their circle of family and loved ones who are affected as well. And as many of you have been at events and was the case at Newton Wellesley, the Natick SOAR group, a group of mothers who talk about their children and the children they've lost to an overdose. And fortunately, one mom was able to have her child there who had survived several overdoses and was now in a good place in recovery. So that was a note of hope. And in my remarks, I talked about, and some of you have heard me speak of this, I really subscribe to, there's an ancient belief that you die twice. The first is when you leave this earth, and the second is when the last person who remembers you stops saying your name. And remembering those people we've lost is really very important. And Middlesex always does a wonderful job of observing these days, whether it's at Newton Wellesley, I was in Lowell at City Hall for the awareness night. Wayland had a great event. So many of you on this task force. And that's emotionally challenging. It's hard to do those events, and yet people remember every year to get that together. So I really want to start by saying thank you. And I also want to talk a little bit, because I know we have some folks who are here for the first time, and this will be old knowledge for some of you, but hopefully new for others. This task force, the gratitude that I have really extends to everyone here, not whether you are somebody who's been with us since the beginning or somebody who's here for the first time, because we began this work here in Middlesex on the task force in 2012, which is shocking to me that that's been 11 years. And that was when we first saw the major uptick in overdoses that were attributable to something that I remember I didn't know very much about at the time, and that was opioids. And we were hardest hit at that point in Lowell. And we went to a number of leaders in Lowell to ask us if they would come together to try to do a multidisciplinary approach to addressing this issue. And we asked if they would be willing to meet at the hospitals, because we wanted there to be a public health focus on this, really take the stigma out of this being just a law enforcement issue. That was so incredibly successful that we then expanded it to 5 regional task forces, all based in our hospitals across the county. We brought in folks from law enforcement, healthcare, emergency medical services, social services, child welfare, the faith community, schools, government, everybody who has a piece of this issue. And we also have continued, and this has gone on through the pandemic, to meet every single month, and it really speaks to the dedication of this group. We begin by talking a little bit about what we have seen in our county over the past month. That being really a good reflection, I think, of where we are statewide, since we have 54 cities and towns and 1.8 million people in very diverse communities. And we've been able to use these task forces to give real-time alerts about what we're seeing, what the changes have been, and there have been many in terms of how this problem manifests itself in our community. We've looked at the commonalities, and we have, as we continue to do that, and keeping in mind always, and I'm encouraged, and I've been mentioning this at some of the events that I've been at, we are continuing now to see a decline in our numbers here in Middlesex. And that speaks to the work that's being done. It also speaks to, and I try to share this with people who are tackling this, the runway that it took us here. One of the most discouraging pieces when we began this work was no matter how much time, talent, and treasure we were putting into it, the numbers kept going up. It probably took us about 3.5 years before we started to see that change. And we see that again this month. Since we met the last time, we have suffered 17 additional overdose deaths across our county. They have occurred, as you will see in the data we'll send out, as is always the case, across about 20 different communities where we have already been able to identify the substance in those incidents. It has been either pills or fentanyl, many of the pills containing fentanyl. They reflect, as they so often do, a range of ages from 20s to 60s. They have, in a change that has continued for a bit, continued to be people primarily suffering an overdose by themselves, either in their home or perhaps in a hotel when they are alone, and then ultimately being found after somebody realizes they haven't come to work or fulfilled some other obligation. And that really speaks to the message we continue to get out there, the importance of not, if you are using, not using alone, the importance of having Narcan in your home or somewhere that's easily accessible. The other piece that I am worried that we have started to see a couple of this month, you remember we did a huge piece when we recognized that a common tale was people telling us that they found someone who had suffered a fatal overdose after having heard that very deep snoring, which we actually know as agonal breathing, indicating distress. We did a big collaboration with Channel 5 to really push that information out, and then saw a reduction in the cases where people were hearing that. When they were hearing it, they were actually calling the police or administering Narcan. I am going to revive that push because we're starting to see that again. So a couple of our overdoses this month, people were reporting they could give us a very good timeline because they knew their friend or loved one was alive at a particular time because they heard the snoring coming from the place where they were sleeping. Also, we are continuing to offer fentanyl test strips and xylazine test strips, as well as Narcan. We have an enormous amount of all of those things. So if you need them, you want to give them out, please do that. But the most important piece is our numbers for this month reflect a 21% decline from last month. And that is the work that's happening in the communities. You remember last month, I believe our decline was at 16%. We're now down by 21%. Translated, that is 35 individuals. And again, keep in mind, we take a small circle of if even 10 people are affected by an overdose. We're now at 350 people who do not suffer that. And I think that's some tangible sign of work that we are doing. I also want to talk about another unfortunate trend, and that is those overdoses that we are seeing where the person has died by suicide. And remember, we set a very high bar for saying that, even in situations where it might appear that the death was by suicide, we do not classify it that way unless there is something very specific, most often a note that's been left by the individual. So across our county, we have seen, as is true across the country, a really compelling increase in the number of deaths by suicide. To give you some idea, I talked a little bit about the size of the county. We had 6 people last weekend who died by suicide. 2 days, 6 people. And that is by all means. But when we talk about the use of substances, we have had 10 so far this year. So 10 very clear deaths by suicide where the means of that death was an illegal substance. Pretty alarming. And given that we just experienced National Suicide Prevention Week and we have a presenter here today who's going to talk about that, I just really want to highlight that for you. And what is most striking is just the range of people and circumstances where that is happening. I'm also very happy to have here this morning two great partners in the state legislature to talk about their work on the Committee for Mental Health, Substance Use, and Recovery, and a bill that we worked together to write and file and just had testimony on this week, an act relative to the establishment of and payment into an opioid stewardship fund. And finally, I'm happy to welcome Jay Garg, who's a senior at Harvard College, who is engaged with the Harvard College Overdose Prevention and Education Student Initiative, to talk about a project he's worked to launch to provide Narcan boxes at every MBTA Red Line station as part of a pilot. And after these presentations, as always, I'll open it up to members of the task force. So we'll begin with Michelle Lee from the American Foundation for Suicide Prevention. Michelle serves as the program manager for the Massachusetts chapter, and she oversees the prevention and education efforts and loss and healing initiatives in the communities across the state. Michelle's worked there for almost 7 years. Prior to that, she volunteered as an Out of the Darkness walker on the Boston Walk Committee and Team AFSP, a Boston Marathon runner. Michelle is herself, sadly, a suicide loss survivor and a member of the Lost Stream of Metro West. We're grateful to have her here with us to talk about the work of the foundation itself and the free programming and support resources and some of their events they'll be doing that this fall. So with that, I'll turn it over to Michelle. Thank you.
Thank you so much. I appreciate it. And it looks like I already have access. So thank you all so much. I'm grateful to be here providing information as it relates to the American Foundation for Suicide Prevention. I put together kind of like a 101. If you're not familiar with our organization, I'll go through the work that we do day in and day out and kind of what it looks like at the chapter level, since we are a national organization. So let me just pull this up. All right, and hopefully everyone can see that. Perfect. So as Marian said, I am the Massachusetts AFSP Massachusetts programs manager. So I oversee all of our prevention education and our loss and healing initiatives throughout Massachusetts. I did get into this work as I was a suicide loss survivor. We Googled, I think, I don't even know how many years ago, to find this organization, and I've been involved pretty much ever since. So it is a pleasure to be here. So what I'm going to go through today is I'm going to talk about AFSP, what we do as an organization, why we fight for the cause. You'll see some information as it relates to statistics and the kind of the scope of the problem as it relates to suicide. Our programming does dive into this deeper. This is, as I mentioned, this is kind of like a volunteer to help get people oriented with AFSP, how we fight for the cause, and then at the local level, what we have coming up, how you might be able to get involved with us. So more about AFSP. Our mission is to save lives and bring hope to those affected by suicide. And I'll get into each area a little bit more, but how we do that is kind of 4 main pillars of work, which is research, advocacy, survivor support, both for those who have lost someone to suicide or also someone who's supporting or has attempted suicide. And then the last being research, advocacy, survivor support, and programming. So we are a voluntary health organization that gives those affected by suicide a nationwide community empowered by research, education, advocacy to take action against this leading cause of death. I will say we have changed a bit over the years, which has been wonderful. When I first got involved with AFSP, it was primarily we were supporting suicide loss survivors. That is no longer the case. We are also supporting those who are supporting someone who has attempted or those who are struggling with suicidal ideation, and those who have had lived experience. This is just kind of an overview I will get into, but our organization was founded in 1987. And so we now have chapters in all 50 states, which also includes Washington, D.C. and Puerto Rico. These are just our core values that we are constantly working towards in the work that we do: passion, community, harmony, impact, and well-being. We know how important all of this is, and kind of having this vision of what we want our volunteers to portray, those who come to AFSP for support. So this is kind of the focus in the forefront of our work. So we are the national leading nonprofit organization dedicated to suicide prevention. We are growing astronomically. I actually served prior to this position as the associate area director and also area director in Rhode Island. And we restructured. And so you'll learn more, but in terms of our Massachusetts chapter, but we have an executive director, a special events manager, and now a programs manager. We used to all oversee everything. One person was overseeing everything. So it is nice to have a bigger team. We engage with those who have been personally affected, mental health professionals, and community leaders. And we've invested over 30 million each year in education, advocacy, and support for those who have been affected by suicide. I think it's really important to learn what AFSP is, but it's also very important to learn what AFSP is not. We are not a crisis center. We are not a direct service organization. So we don't run our own support groups, though you can find listings to support groups on our website. We host it there, but we do not run those. Our chapters are not support groups. The work that we're doing is really prevention work, and you'll learn more about that. And AFSP does not make grants to other organizations. We will support other organizations. We will attend events. We'll share resources free of charge, but we do not provide grants. So this is very important. We know partnerships like this one. We know that that's how our work gets done. So this is just kind of a highlight of some of the partnerships that we have. And these are our national partnerships. But you'll see a ton on here. And so it is really important that we build these partnerships to provide information like this, resources, to provide programming, and also for the support that we don't have. So you'll notice the National Suicide Prevention Lifeline. We always refer people to that, or the text line, the Trevor Project, since we are not a direct service organization. So why we fight for the cause? We know that mental health is better understood. We still have a long way to go. Unfortunately, there is still that stigma surrounding mental health and suicide, but we have made progress. And so it is really important, especially as we think about coming off of the pandemic. The biggest shift, I will say, in terms of a personal kind of change, was I saw the week that we lost Anthony Bourdain and Kate Spade in the same week. I feel like that really was a switch. I feel like the conversation really started to change, because it was these people that we're seeing from the outside that seemed to be perfect, to seem to have everything that they could possibly want or need. And we had hundreds of others who had died by suicide that week from all over the country, from all over the world. So I do think that was a really big shift in the conversation. So we know that there's a better understanding. We know that people are interested in learning more and are hopefully taking the steps to get that support. Suicide prevention is gaining strength, and those affected are speaking out and getting involved. As I mentioned, when we first got involved with AFSP, it was a lot of people who were suicide loss survivors, and now it's people who have attempted or are supporting someone. More collaboration in what we do. You saw on the last couple of slides the partnerships that we have and the relationships that we've built. So it's really incredible to kind of keep moving the movement forward. And then changing attitudes about suicide and mental health, which I'll share a little bit more on in just a few moments. So as I mentioned, so this is kind of a overview of AFSP, but we do have programming that specifically talks more about and shares more statistics, but this is an important piece. So suicide is one of the leading causes of death in the United States, with over 48,000 Americans dying each year. That number is from 2021, which is the most recent data we have available from the Centers for Disease Control and Prevention. Suicide is the second leading cause of death for those ages 10 to 34. And it's also estimated that there are 25 attempts for each suicide death. So that's about 1 million suicide attempts each year. So here's a breakdown of suicide rates around the United States. I'm actually, in the next slide, I'll share a breakdown of Massachusetts in particular. As you'll see, we have one of the lowest. We are in the lower third of suicide rates in the United States, but we still have over 600 deaths by suicide. So yes, we're low, but we're not that low. So there is a lot of work to be done. But this is just a good representation of kind of where we're at and the goals that we have, obviously, to reduce the rate. So this one is specific to Massachusetts, you will see. So I won't read all of this, but it is the 15th leading cause of death. And as we mentioned at the beginning, second leading cause of death for ages 10 to 24. Second leading cause of death for ages 25 to 34. So you'll notice our state rank is 48, but as I mentioned, we have over 600 deaths by suicide. Again, this is from 2021. So we have a long way to go. We have a lot of work to do. And, I look forward to partnering with all of you in some capacity and helping to raise awareness for suicide prevention en masse. We've also learned through research that though suicide is a leading cause of death, suicide can be prevented. Just like there are warning signs and risk factors for other health issues, we know through our research that there are warning risk factors, warning signs, protective factors that can all kind of converge to help us support somebody who might be struggling with mental health or suicidal crisis. So this is also important. I mentioned before why now, and kind of the timing is perfect for the fight with mental health and suicide prevention. But there was a poll done by sponsored Harris poll where most Americans believe that mental health is equally as important as physical health. Most Americans would do something if someone close to them was thinking about suicide. And most Americans do believe that suicide is preventable. So we know this information that will help us kind of educate people on what to do when we are concerned about someone and how to have that conversation. So how we fight for the cause, I think this is kind of the most important. That was kind of an overview of what AFSP is and what we do. But this is really the work that we're doing day in and day out. So here's kind of a abbreviated list of what we do in terms of our work every day. Research connection, prevention education, loss and healing, advocacy, our interactive screening program, community engagement, which is what we're doing today with the Massachusetts chapter, and then our Out of the Darkness walks. And I will share more about that since we are in the really in the thick of walk season right now. So AFSP is the largest private funder of suicide prevention research. We have a current total investment of 23.7. So a lot of money. And what this is helping us do is to learn more about suicide, to develop programming that will support at-risk populations. We know that the suicide rate is high amongst everyone, but really making sure that we're supporting those with higher rates of suicide or who don't have access to mental health care and support. So that's really kind of what our research has informed. And as you'll notice, our research priorities include diversity, technology, and survivors of suicide loss. I think the technology one we get a lot as it relates to cyberbullying and things like that. So we have a long way to go, but we are learning more every day. Prevention education. So this is kind of my realm as programs manager, but we provide programming free of charge to anyone and everyone who wants it. So we have programs, you'll notice the Talk Saves Lives program, which is our kind of suicide prevention 101. It's a 45-minute to hour presentation where we talk about the scope of the problem, the research, the risk and protective factors, and then ways as community members, colleagues, friends, we can prevent suicide. I would say this is probably our most popular program. We've pretty much been hosting it every day this month with National Suicide Prevention Month, and lots more to go in the coming weeks. So if there's any interest, again, at the end, I will share my contact information, but if there's an opportunity for us to provide that program, we certainly will. And then you'll notice some other programs, which are our It's Real. This page needs to be updated. We do have an It's Real for middle school students, and It's Real for high school students, and It's Real for college students. All a little bit different, but focusing on that age range and talking about mental health and getting the support that we need. We have More Than Sad program for teachers and parents. And so this is kind of, I mentioned some of them, but our It's Real programs, our senior or our More Than Sad program, It's Real, Talk Saves Lives. I mentioned our Talk Saves Lives program as being one of the most popular. We do have several different modules to that program as well. So we have LGBTQ plus, seniors 65 and up, Latinx and Hispanic communities, and we have new ones that are being developed for firearms owners. We provide that to a lot of police departments or shooting ranges or gun retailers, and keeping people safe. So we have a ton of different programs. I won't go into each because it can be overwhelming. But as you'll notice at the bottom, we have afsp.org/community-programs. Again, I'm going to share my information at the end, but you can always schedule a time with me to connect to see how we can implement programming. Again, I just want to highlight that these programs are all free of charge to anyone and everyone who wants them. So we're working with schools, companies, churches, community groups to be able to share this information that can be life-saving. Some additional prevention education materials. I think I mentioned we go to a lot of tabling events. I'm actually heading to one at Boston University after this. And so we have a ton of materials that will support any events. We go to Pride Fest, farmers markets, anywhere that we are invited or, where people want us. But we have a number of resources after attempt. We have a lot of resources for after the loss of a suicide. And these are this is just a tiny little snippet of what we have. And again, these resources are free of charge. So we provide these to libraries if they want it, police departments if they want to have some of this information in their cars, especially if they're responding to a suicide. But there's a lot of great information that we can provide, even if it's not a program. Another aspect of our work is loss and healing. We, as I mentioned at the beginning, we're not a direct service, but we do provide support for suicide loss survivors. So one program which we have throughout the entirety of the year is Healing Conversations, which is a peer-to-peer support for those who have lost someone. So someone will go onto our website, they've lost a child or a parent, a spouse, and we'll connect them with someone who's trained on our team who has experienced a similar loss. And again, it's a one-time visit. All of these resources are free for anyone who wants them. And then the other event that we have every year is International Survivors of Suicide Loss Day, which is actually coming up in November. It's always the Saturday before Thanksgiving, before the holidays. And it's a day to connect, to heal, to grieve together with people who understand. You'll learn, I'll share a little bit more about our Out of the Darkness walks, which anyone and everyone's welcome to participate in. But Survivor Day is really the one day that survivors come together for connection. And so we will have several sites throughout Massachusetts on that Saturday. We will also host a virtual program for anyone who's maybe not comfortable or for someone who doesn't want to leave their house and go somewhere for the first time. On the Sunday following. So again, I can share all of this information and I will share our website as well because it has all of our upcoming events on there. And then samples of loss and healing materials and booklets. This is after we are notified of a suicide. I don't get information every time there's a suicide in Massachusetts, obviously. But if someone does reach out, these are kind of the resource guides we provide. After a suicide brochure, surviving a suicide loss, we have resources for children, teens, and suicide loss. And we also have a toolkit for schools if they've experienced a suicide in their community or, a student in the school. Another piece of what we do is advocacy and public policy. We advocate both at the national and local level. And typically it's for more funding for mental health and suicide prevention, but sometimes it's, the past few years, our biggest focus was to get the National Suicide Prevention Lifeline reduced to a 3-digit number, which hopefully all of you know, which is 988. And so advocacy work with AFSP and other like-minded organizations successfully passed that. So that is now the lifeline number. So again, we advocate, we host an advocacy state capitol event every year at State House in Massachusetts, which is in the spring. So if you are interested in advocacy work, we would love to have you join us. And then our Out of the Darkness walks. I keep mentioning these. As I've said, we are kind of in the thick of walk season right now, but we host our community walks in the fall. We have 8 across Massachusetts. You will see a list at the end of the presentation with the dates. We also work with high school and college students in the spring to host our Out of the Darkness campus walks. And then we have our overnight walks. Those are hosted by our national walks team. We have one location every year. This past year it was in Washington, D.C. I had the privilege of being able to walk in that. It's all night, 18 miles, but it's an incredible experience. So that is certainly a larger thing to take on. So our community walks are usually about 3 miles. And we've only had one, so we have 7 left. So if you're interested in walking with us, there's no registration fee, there's no fundraising minimum. Anyone and everyone is welcome to walk with us and be a part of the movement. Communications and marketing. This is really just an important piece of what we do. As I mentioned, it's National Suicide Prevention Month. So you might see stuff on, if you follow us on social media, with Talk Away the Dark, which is our campaign to encourage people to have a conversation if you're worried about somebody, if you're worried about yourself. And so some of the other campaigns we've done is our Seize the Awkward campaign, specifically for teens, and then our hashtag Real Convo. So this is really just a piece that we're constantly working with news outlets, radio stations to provide safe messaging, to share our information appropriately. Some communications partnerships, you'll see all of these. I'm sure you've seen some of them in the past. As I mentioned, the Seize the Awkward, Netflix specifically, after 13 Reasons Why, we really built a big partnership due to the safety, the safe messaging that was not originally part of that show, but then changed moving forward, which is great. So I mentioned Seize the Awkward, which is a public service digital campaign. If you've never seen anything related to this campaign, I encourage you to go to seizetheawkward.org. There's wonderful videos, there's different graphics, things like that. And it really speaks to the ages 16 to 24. They have Billie Eilish and some other people who I'm not super familiar with, but all great for that audience and that age range. And so it's specific for having a conversation, and it's a bit less corporate, I would say, than like a Talk Saves Lives program. It's more supportive, like, how's it going? What's up? Things like that. But it's just really helpful, and it's a great campaign. And then I mentioned our Real Convo, which is a public service campaign with a focus on, for the general audience, on having a conversation about mental health. Have a real conversation, have an honest conversation, and talk to somebody if you're concerned or if you are worried about yourself. These are just some other examples of communication and marketing materials that we've shared. I mentioned that we have at tabling events. And then briefly at the local level. So all of the work that you've already seen is what we're doing at the local level. It's just specialized to Massachusetts, of course. So as I mentioned, we have chapters in all 50 states, in Washington, D.C. and in Puerto Rico. And so we're all doing the same work to support those in our state. And so we engage with families, mental health professionals, we attend events like this meeting. We work with community and local business leaders, schools, and anyone who's interested in preventing suicide. Maybe they're volunteering, maybe they want to bring a program to their community. We'll kind of support whatever it is that they're looking for. This is just our fun graphic that we use. It's actually on the shirt I'm wearing right now, but our Massachusetts Together to Fight Suicide, which we use on our Out of the Darkness shirts, just to show unity across the state and the work that we're doing. This is just, you already know me. I have been talking for a while. But Jessica Vanderstad, who is our executive director, Heather Claflin in the middle, who is our special events manager, oversees all of our walks, all of our fundraising. We have a Boston Marathon team. We have our annual A Sip in the Park event at Fenway. So it's really all 3 of us who are making all of that happen throughout the state. And then I mentioned our Out of the Darkness walk. So I did just want to share kind of all that's coming up. We have a walk this weekend, 2 next weekend, but these are all of the walks that we have across Massachusetts. The Central Mass Walk took place last weekend or 2 weekends ago, but you can sign up, or you can learn more and sign up at afsp.org/mass walks. But like I said, we're really in it right now with our walk season. So things have been busy. I've been doing programming pretty much every day for companies, schools, community groups, anyone who is looking for programming, especially during National Suicide Prevention Month. So I will keep this up if anyone wants to take a photo or wants to learn more. But I will pause there. I saw a couple of chats pop up, so I'm happy to answer any questions. And I'm also going to share my information so you can reach out to me directly if you're interested in bringing up programming, getting involved, becoming a field advocate, anything that I can do to support. I'm happy to do so. Okay, it looks like a couple questions. So, in terms of the commitment for research, so I think our research is available. I can share the link to all of our research priorities on our page. It's a little overwhelming for me. I don't know all the research that's going on, but I'm happy to share a link to that. So a great question on the funds for our research, for anything that we do, all of our programming, how we are able to do what we do is from our Out of the Darkness walks. Those are really the biggest way that we fundraise. And so the funds, half of the funds go towards research and half of the funds stay in the local community. So we're sending it to research to kind of learn more about suicide, to develop the programs, to then what we are implementing on the ground. Seize the awkward. I'm so glad someone's heard of that. That's amazing. And then also a question about resource materials to provide to our patients. So I will share a link after this. I think there's just a couple more slides. I will share a link that I can provide, and you just fill out this materials request form, and we just send you the materials. You can also always reach out to me again. I will share my email in this as well. So that way you can email me if you have any questions, anything that I can do. And then this is just kind of an overview of getting involved. You can walk, you can sign up to become a field advocate. You can partner with us. I would love that, to be able to bring programming to your community, to your workplace, anywhere that I possibly can. And then we're always looking for people to get trained in our programs. So if you are interested in becoming a trainer, I'm happy to host you in a trainer event that we have, and be able to kind of support you in that way. So I kind of flew through that. I know there were some questions, but I will pause there for any questions, any other additional questions. And again, I do want to also share my contact information so you all have that to reach out to me.
Thank you, Michelle. That was great. Thank you.
Thank you so much. I know, I'm sorry if it was overwhelming, but I'm happy to hang on and answer the questions in the chat and just share extra links. But I wanted to make sure that everyone knew the work that we are doing. And I'm so grateful to be able to have provided that, and look forward to working with all of you.
And we will make the recording of this available.
Oh, perfect.
We'll have that. Yeah. Anybody else have any last questions for Michelle? I think we got everything, and you have our contact information to follow up. And amazing materials, really good materials. I hope people take advantage of that. So thank you so much.
Yeah, absolutely. Thank you. And I will just hang on a couple minutes to to answer the questions and share some links, but obviously feel free to move forward.
All right. Thank you so much. Thank you. All right. Moving to our next presentation. And you know, I really want to start by saying that, and I say this very often, we in this county are incredibly fortunate in the legislators who represent us. It is not the case everywhere that there are the kinds of partnerships that we have here in Middlesex. You know, in many places, there's a total disconnect between the DAs and their legislative partners, between legislative partners and some of the community groups. And we really do not have that. And that is why we've been able to accomplish so much. And two of the people who really exemplify that kind of commitment are our two guests today. I have to say, I think in the last 2 or 3 weeks, this is about the 4th or 5th time I've seen each of them. So it gives you a sense of how much we're together and working on things. And we are really happy this morning to have with us Representative Simon Cataldo, who represents the 14th Middlesex District and serves, as I mentioned, on the Joint Committee on Mental Health, Substance Use, and Recovery, as well as the committees on the federal stimulus and census oversight, financial services, and the Committee on Labor and Workforce. But really what I have seen of Representative Cataldo is that he has spent his career prior to going to the legislature working as a special education teacher, as a federal anti-corruption prosecutor at the Department of Justice. And he's delivering for kids, for their families, for school communities, and around the issues of democracy and integrity in government. He's been a real partner. He co-sponsored with us the act regarding the stewardship fund, which some of you will remember us talking about this before. This bill seeks to expand people's access to naloxone by supplementing the cost of insurance copays. We have unfortunately seen situations where people have bought naloxone or had it provided to them. They use it for somebody they love. And then because of the copay, which can be up to $50, they maybe aren't in a position to immediately replace it. They need it again and they don't have it. You know, I was saying the other day, from when you had to kind of secretly get Narcan, and when I had to get an emergency room doctor who would sign a standing order for us so that we could give it out. Massachusetts has made great progress. They've made it available beginning this year over the counter. We are also grateful that a number of insurance companies, most notably in the last couple of weeks, Blue Cross Blue Shield, are covering the copays to make it universally much more available. But until that's the case for everybody, there's a lot more work to do. And this bill, which would impose some cost to anyone who manufactures, delivers, or sells opioids in Massachusetts, to have a fund that the Department of Public Health could use to defray that cost of copays, it will be an important step. So we're happy to have Representative Cataldo helping us with that, and as well, Representative Kate Donahue. Representative Donahue represents the 19th Worcester District. She serves as well on the Committee for Mental Health, Substance, and Recovery, as well as the Committee on Consumer Protection and Professional Licensure, something that affects our lives more than we know. The Committee on Education. And Kate's been a friend for a very long time, and she's been an incredible partner on this issue. Sadly, in 2018, Kate knew the pain of a child suffering a fatal overdose. She lost her son, Brian. And in the spirit that I think is just so remarkable and so true of so many people doing this work, she took that grief into action, and she really focused on policy changes, harm reduction, addiction treatment. I'm really grateful to her for her leadership on these issues, and also for co-sponsoring this bill with us, and for being here this morning. So I'm going to turn it over to both of you to talk about a little of the work that you've been doing in this area, and then hopefully take some questions. So thank you both. I am really grateful.
Thank you, District Attorney Ryan. Hi, everyone. Simon Cataldo, State Rep for the 14th Middlesex. I just want to amplify a couple of points that have been made, and glad to answer any questions. And DA, can you hear me okay? I'm coming to you from the Chelmsford Housing Authority common area.
I thought I recognized that space.
You do. Yeah, I figured you would. Yes. So Michelle mentioned a couple of moments ago State House Advocacy Days. It's really important that we hear from you. You're doing incredible work on this task force, and work that I really respect and really admire. At the State House, there are so many issues that are going on, and it's really important that we continue to hear from you. So I'd encourage you to engage with Michelle's group or any other group that in these State House Advocacy Days, or to write to us and to write to your reps and your senators about what you want to see happening. I also just want to double down on the point that the DA just made, that we have really tremendous collaboration with the DA's office, and we are so fortunate in my district and the surrounding areas to benefit from a DA and a DA's office that is creative and forceful and thoughtful and collaborative on these issues. The bill that DA Ryan just mentioned, that was a collaborative effort. Her legislative team brought that to me. I partnered up with Rep. Donahue because I consider her an expert in this area. And we are both fortunate enough to serve on the committee that is hearing the bill. And I think one of the reasons that we're both serving on that committee is not just because of our personal interest, but because the issues that are being tackled by the Mental Health Substance Use and Recovery Committee right now are some of the biggest, maybe the biggest, that I heard about when I was going around door to door and getting into conversations with folks. So the work that you're doing is so pressing, not just for your lives, but for the broader community. I did just want to also mention that another way that I'm working with DA Ryan is on the Restorative Justice Advisory Committee. I was appointed by the House Speaker a couple of weeks ago to be the House member on that committee. And that committee is looking at further implementing the 2018 criminal justice reform law that is putting into place diversion programs for folks that come into the criminal justice system and really ought not be there for the long term. And I think that's a large number of people, and that legislation reflects that. I'm really grateful to be part of that work, in part because in my prior career as a federal prosecutor, I helped run at the DC U.S. Attorney's Office the drug court and the mental health court. So I think that there's very promising work happening in that area for our community at the state level in Massachusetts. My team is sharing my contact information as well as the bill that DA Ryan just described. I'm excited about that. And by the way, DA Ryan did an incredible job of testifying before the committee just a couple of days ago. So she just continues to be an outstanding advocate in so many ways for us. I will yield the floor to my colleague, Representative Donahue, who's a friend and just a champion of these issues. Thank you so much.
Thank you. Thank you. Representative.
Thank you, DA Ryan. Thank you, Rep. Cataldo. I just want to thank everybody for the opportunity to be here. I want to thank all of you for the work that you're doing. As DA Ryan mentioned, I lost my son, my only child, to an overdose back in 2018. I had already seen the work that DA Ryan was doing to support people who are struggling. I recall, I think the first time I told DA Ryan that my son was struggling, the DA came to a Learn to Cope group in Hudson, Mass. And it wasn't my home group, but I wanted to be there to say thank you and to share my story. I've been active in politics for many years, and when we talk about stigma, this stigma against opioid use, this stigma against mental health in general, that it's not really considered the same. I remember when my son had a back injury, in part as a result of risky behavior from substance use. And I happily shared daily updates with family members and others on Facebook. Fast forward to 6 months or so later, and the surgery and the access to opioids had put my son into a downward spiral. And he had an almost successful suicide attempt back in 2015. And because of the stigma, I sat there alone next to my son's bed in a way that was very, very different than when he was dealing with a back injury. Things have changed, but it's important for us to share our stories. I share my son's story because it helps put a face to the problem. I share my son's story because we need to show support. We need to show that the people who are struggling with substance use disorder, they're our family, they're our parents, our siblings, our brothers and sisters, and yes, our children. I believe that as a person who has lost a child to substance use disorder, I'm able to share my personal story in a way that makes a difference. And I don't know all of you here, but I'm sure that some of you have personal stories to share. And I just want to thank you for that. And once again, to thank DA Ryan, Rep. Cataldo, and everybody for all the work that you're doing.
Thank you, Representative. Thank you. That story is important. And you certainly, I'm not sure you were with us earlier when I was talking about the importance of saying people's names and remembering them, and you've certainly done that for Brian, and I have enormous respect for that.
Thank you.
Anybody have questions, comments? Things you'd like to see happen, hope of being considered? This is an unusual silence for this group, so they are,
I got something.
all right. Oh, Dave?
Yeah, actually, I just want to personally thank you on behalf of the Vigil on the Common we did on Awareness Day. Madeline provided us through you the fentanyl and xylazine test strips. And I had the Mass DPH come in with a bunch of literature and bags. And I had a beautiful display. I think Madeline has a copy of it I sent to her. So thank you. We gave out about 100 test strips to people. It's also televised on open public media.
Thank you. Thank you. Well, Representative Johnny, Representative Cataldo, thank you both for being with us this morning. I appreciate that.
Thank you. And thanks to
Yes.
everybody for all the
Oh,
work. you do.
sorry.
Can I say
Sorry.
one thing? I think
Oh,
that
sure.
Kate, your story is just overwhelming as brief as it was, and I think that really, and Senator, Cataldo, that what you're doing just gave me such great pause. Marion is right. It is an unusual silence for all of us, and I just think that we were commiserating about the loss of so many, and you just brought it to light, and I had no words myself.
Sorry, I'm sorry, Representative Cataldo. I didn't let you finish.
Oh, no, I was just going to reiterate my thanks to everybody for the work you're doing. I know it's so personal for many people, and but it is making a difference, and there is a lot happening on the state level. And even though you're quiet now, you don't have to be quiet at other times. Please, continue to reach out and let us know what you want to see happen, even if it's not connected to a specific bill. It's very helpful for us and really necessary for us to hear from you. So thank you.
Thank you. Thank you. All right, and moving on to what I think is pretty exciting in terms of a student-run project. We're now going to hear from Jay, who's the co-president and policy chair of the Harvard College Overdose Prevention and Education Students, called HACOPS organization. That's a student-run organization that works to further policy and advocacy efforts around the epidemic. Jay's a senior at Harvard, majoring in economics with a minor in astrophysics. And he's going to talk about the project that I mentioned that he's come up with about having Narcan available at Red Line train stops. And, I just want to take that opportunity as well. I think even for us here, we have, for the first time with our new DAs who began this week, been providing them with Narcan to have in their car or on their person. I think if you haven't seen it, we'll put it in the chat. The Boston Globe did a really good article about a week and a half ago about even if you yourself don't use drugs, or you think that you think, and probably incorrectly, that you don't know anyone who does, how important it is to have access to that, how you can just jump in and help somebody in circumstances. Our goal is to really have it be like defibrillators or something that are around every place. And I know that's Jay's goal as well. And I really commend you're here in our community for a relatively shorter period. You've just jumped in and taken charge of this project. So thank you. Tell us about it.
Wonderful. Thank you so much, DA Ryan, for having me here. And I also want to say thank you to Representative Donahue for sharing your story. That was really meaningful and impactful. And thank you to everyone else for all of the wonderful work that you all are doing. It's been really impressive hearing about all the work that this group has done so far. And it's great to be here. It's really an honor. Can people see my screen right now?
All set.
Wonderful. So like DA Ryan just said, my name is Jay. I'm a student at Harvard. I study economics. And I have the pleasure of being the co-president right now of the Harvard College Overdose Prevention and Education Students, which is a student-run organization. We go by HCOPES, that tries to help wherever we can with these kind of policy and advocacy efforts related to the opioid epidemic. And so one of the projects that we've been working on for several years now has been to get Narcan put in MBTA stations to make it publicly available there. And there's kind of been recent movement on a legislative front in making that happen, which we are very excited about. And so I'd love to share that with you all. But I would also love to hear any thoughts or insights or feedback that you all have. So if anything comes up, please feel free to kind of reach out with any questions, and I'll put our email address at the end as well. But would love to hear from you all. So this project kind of started a couple years ago when we saw some members of our group saw this heat map that's produced by the Cambridge Health Alliance, and it shows non-fatal opioid overdoses in Cambridge from 2016 to 2017. It was collected using 911 call data. And what you kind of see when you look at this map is that a lot of the overdoses are clustered around T stations, which is not particularly surprising. T stations are in areas with a lot of people. But the more we looked into the data, we reached out and got the underlying data, and we also had a lot of conversations with people. The more it seemed like there actually were a lot of overdoses happening directly in or immediately around these MBTA stations. And there are a lot of potential reasons why that could be happening. T stations, they can be dark and somewhat secluded. Sometimes they have private bathrooms that lock. Sometimes they have temperature control, or they're kind of sheltered from the elements. So there's a lot of reasons why T stations may be a good spot for people to use. But what that means is that there's a higher than expected incidence of overdoses happening in these T stations, and they tend to be somewhat difficult to respond to because they're kind of complicated and it might take a while for people to notice. And so as we were looking at this map and we were talking, we began thinking about how wonderful and great it would be if Narcan were available in the T stations themselves, so that when someone noticed an overdose happening or recognized an overdose, they were able to access Narcan much more quickly in order to respond to that overdose. So from there, we had a lot of conversations with a lot of incredible people who are working on this from a number of different angles. So we talked with public health officials and experts, we talked with researchers, we talked with doctors, we talked with people who use, we talked with academics, other students, we talked with first responders, and we talked with organizations that had implemented similar projects, though not in big transit stations in the past. And so we were fortunate to get insights from all these different people, from more than 50 individuals and organizations. And those conversations really were what drove the project that we ended up kind of coming to, and were invaluable for helping us to move all of this forward. So I'm very grateful to all the people who helped us along the way. And there were a bunch of questions that we were asking people as we were kind of thinking about what a possible intervention could look like. So one was a very tangible, what should this literally look like? How could we incorporate naloxone into these stations? How would it work? How would people access it? But then there were questions about kind of what, how we should structure this. Should we alarm the naloxone or not alarm the naloxone? Should it notify emergency responders that the naloxone had been taken, or should it not do that? Could that be stigmatizing, or could that deter people from accessing it? What consequences could this program have? We wanted to make sure that people continue to call 911 in addition to being able to access the naloxone. And kind of from an implementation perspective, how would this actually work? How would the T access the naloxone? How would they restock it? And how have kind of other locations that have made naloxone accessible managed to do similar programs? And so this is what we had originally come to. It's changed a little bit since then. But the kind of original proposal was for a pilot program in the 5 red line stations in Cambridge. And each pilot station would have 2 of the nalox boxes that you can see in the image to the right. They would be unalarmed, was the consensus that we kind of got from a lot of the experts that we consulted. They'd have the standard box of Narcan in there, intranasal Narcan, and there would be information about how to use naloxone put up nearby. And kind of the crucial step, and what has been the biggest outstanding question to figure out is the restocking of the Narcan. And so the MBTA was the one who we hoped would be able to replenish the naloxone if it was taken. What we've kind of anecdotally heard from other locations that have done similar initiatives is that that's not a particularly hard task. Some programs put like a little zip tie around the handle of the box. It's super easy to break, but it means that someone can walk by at the end of the day. If they see the zip tie, great, you can move on. If you don't see a zip tie, then you replace the Narcan in the box, put a new zip tie on, and move on as well. So it's kind of a minute-long task. And so that was the original proposal, and these were kind of the different dimensions that we were thinking of as being very important. So the naloxone would have to be incorporated and maintained and restocked, like I just said. But also we were hoping to partner with public health departments to publicize that it was there and to provide training opportunities. We wanted to partner with academics to evaluate how well this was working. One of the things that we noticed as we were working on this project is that even though a lot of great public access Narcan and Narcan distribution efforts have happened all over the country, it's somewhat difficult to find instructions for how to do this and information about exactly how well it worked and what you saw. And so we were hoping that being able to provide some of that information would make it easier for other teams to do the same thing. And then finally, we were hoping that we could find some stable source of funding with the support of the legislature and potentially with the support of additional grants. So this is the timeline of what the project ended up looking like. In March 2021 was when we began really seriously having conversations with different stakeholders and different people who might have information about this project and insights. In February of 2022 was when we first met with the MBTA. We were able to talk with people from their general manager's office, but also with their finance, legal, and operations teams. And we got really positive feedback from that meeting. There were definitely big outstanding questions, in particular that restocking question that was kind of outstanding. But I think we were worried we were going to meet with a hard no, and we did not get that hard no. But we heard soon thereafter that because the MBTA, if you've been following along with the news, has had a number of other big issues and questions on their plate, that this wasn't something that they felt comfortable moving forward with. And so in November 2022, we pivoted and we began to work with some fantastic legislators. In particular, State Senator John Keenan from Quincy, Mass. was super instrumental to pushing this forward. But we began to work on a series of bills and a budget amendment in order to help get this proposal to happen kind of through other means. And then in August 2023, we were super excited that Governor Healy signed into law a budget that contained an allocation for this MBTA pilot. So there are a couple kind of key differences that came about during that legislative process, though, between the proposal I just outlined and what's actually going to happen, all of which I think are fantastic. So the first is that we had originally outlined for there to be 2 boxes per station. Now there will be 3, one on the inbound platform, one on the outbound platform, and another if there's a bathroom or an elevator or something like that in the station. Before, we had proposed having implementation just in the 5 red line stations in Cambridge. Now it will be implemented along the entire red line, as DA Ryan said. Before, it was kind of structured as, or at least conceptualized as, we'll have this year-long pilot and then we'll figure out how well it worked and go from there. But now, because it was included in the budget, implementation will start somewhere in fiscal year 2024. And hopefully there will be kind of continuous data reporting and evaluation along the way. And if it goes well, hopefully it will also be included in the budget for fiscal year 2025, that we'll cross that bridge when we get to it. And before, we had estimated a potential budget for it and how much it will cost. And now we have $95,000 that was allocated to the program. And so it's a question of how to use that most effectively to make this happen. So that's kind of what this proposal, or what this program, I guess, now will actually look like. There are a bunch of questions that we've realized along the way we can answer anecdotally from other locations. We've talked with a number of experts, and so we think that we've collected really good answers for a bunch of these questions. But we want to make sure that as this program begins to start, and it hasn't actually reached implementation yet, the boxes aren't in the stations yet, we want to make sure that we're staying on top of these questions, and we're really being vigilant and making sure that this program is working the way that we want it to, and it's working in the most effective way possible. So some of kind of the big questions that we're planning on focusing on are the implementation questions, how frequently is the naloxone being used and changed, how feasible is this for the MBTA to implement, and what could be done to streamline it. Outcomes, of course, is this effective? Is the naloxone helping people? And usage as well. Are we seeing changes in where people are using opioids, or how frequently people are using opioids? And how can this intervention be something that's kind of sustainable, both for the MBTA and for our community members? And then, of course, we really, really want feedback from community members, from people who use, but also from everybody who kind of notices this project. Do you know that naloxone is now available in the T stations? Have you used it? Does it seem like something that's helpful or that you like? And how can we make the program better? In terms of what comes next for us, so I mentioned that this hasn't actually hit the stations yet. There are ongoing conversations between PSAS, between the MBTA, and between Senator John Keenan's office and the legislature to figure out exactly how implementation should proceed from here. So the budget amendment is a little bit more vague than the kind of proposal and the things that we've written about the proposal originally. And that's by design, to make it so that the MBTA can kind of work with us in order to figure out what's the best way to implement a project like this in their particular context. But there are also outstanding questions that we're working with the MBTA to figure out. We think we have answers to a lot of these, but this is kind of an iterative process, is what I have learned. So where the boxes should be within the stations, who is going to restock them, how can we minimize the liability that the MBTA is worried about related to that restocking, are all kind of things that we have a pretty good sense of where they're going, but continue to be ongoing conversations. But then also, we want to keep publicity around the project high. We want to make sure that the MBTA keeps this top of mind. And we're already beginning to think about potential extensions to the project. So one thing would be, how can we kind of incorporate these nalox boxes into existing emergency response protocols? We know that people are calling 911 when they see an overdose in the stations. How can we make sure that it's kind of a seamless integration of this naloxone from there, but also evaluating the efficacy of the program, like I talked about, and then beginning to think well into the future of, if it seems like this project is actually helping people, what are the kind of next steps and where should we go from here, in terms of expanding to other lines, expanding to bus systems. I think there's a lot of different places where we can take this. And like was already said, I think that the more places and the more accessible that we can get Narcan, the better off everyone will be. And then finally, we have some other projects in the work that kind of build on this and the same concept of making Narcan more available. And so one that I'm very excited about is we've begun doing research alongside a couple municipalities into how they could start a harm reduction vending machine program, which has been implemented in many, many other places across the country to great success so far. And so it's something that we would love to see in Massachusetts as well. So I really appreciate, again, all of your taking the time to listen, and the many, many people who helped us to make this project actually happen. It wouldn't have happened without all of the fantastic support that we got from our community members. And if you have any questions, I would love to talk about them right now, but also feel free to email harvardcopes@gmail.com. And we would love to hear from all of you and to learn from your expertise. So thank you so much. And I will stop here.
Okay, this is really just a great project, and I would suggest that you are learning as much about government as you might be learning in any classes, and trying to see what the issues are and put this together. And again, I remind people, as ours in our county, over 50% of the time when people arrive, when first responders get to an overdose, someone has already given at least one dose of Narcan, a family member, a stranger, whatever it is. So people are doing it. This just helps to reduce the stigma. Dr. Armstrong, did you have a question? We can't hear you.
Perfect. I'll look for it in the chat.
Any other questions? Got some great kudos in the chat as well.
Hi, thank you, DA Ryan, again for another amazing program. This presentation, is it Jamie? Forgive me. Or
Jay.
James, your name? Jay.
Jay, yeah.
Thank you, Jay. I work in a public health department and work in prevention. And I just want to say that prevention can work and support for mental health and substance can work. And your presentation is what we need to hear for hope. And what you did to get your project funded in the Massachusetts budget is like unprecedented, so fast. So over years of doing this work, so I hope you and your team understand how invaluable your work is. I also want to say it confirms that getting young adults, youth involved, changes the conversation and adults listen to you. So thank you. And I appreciate you sharing your program. And I hope you recognize that this is incredible work. Next, my real question is, other than those honest comments, colleges. Maryland has a consortium of prevention groups across colleges. Are you at Harvard the only ones you know that do this work? If you are, have you ever shared your work with other schools? The gift in Massachusetts, as you know, is the power and brilliance of our people in universities. So that's my question. Do you know of others? Have you shared your work with others? And thank you, Jay.
Yeah, definitely. Thank you so much, first of all, for your kind words. I completely agree that I think it's just been incredible how many wonderful people who are really doing this work across every dimension of this work were willing to talk with us and help us along the way. And we're all just incredibly excited that this worked out. In answer to your question, I think there's a separate smaller group at the Harvard Medical School that works on some of this. I think their group is more focused on training people to respond to overdoses than kind of on the policy side. And we've talked with students at a number of other schools in the area about how they could start their own groups. But I'm not sure in what stage those kind of projects are right now. So I think I'm hopeful that some of them will be able to get off the ground in the near future, and happy to help however I can. And I guess just one slight additional add to in my answer is I think the students at a college are super important for kind of mobilizing to help push for some of this stuff. I also think that there are so many colleges in Massachusetts, there's a lot of work being done by the universities themselves to figure out how they can, begin to respond to this stuff. And so I've had some great conversations with our own administration about how university health services can very slowly begin making Narcan available on our campus and begin better preparing students and staff members to respond to overdoses if they see them as well.
Thank you. What can
That's
we do?
awesome.
What can we do to help you? Like, what can people on this call do that would be helpful?
Yeah, I think knowing that this call exists and that there are so many wonderful people who come together every month to talk about this is, I think, just great. We are beginning to start some other kind of policy projects. So the vending machine project that I mentioned on the call, and then trying to look where else would be helpful to get involved. So I think I will definitely keep this group in the back of my mind going forward. And if we come up with questions where it would be useful to get either outside expertise or to see if there's anyone who can kind of help us make connections or push something forward, I would love to be able to bring that back to the group. And I think similarly, we have a lot of students who are really excited to get involved with this work. And so if there are ways that we can help with any of the items that this group is thinking about, please do feel free to reach out. We'd be happy to help in whatever way we can.
And you said it was Senator Keenan who's been helping you? He's incredibly responsive, so we're happy to share an email address for him. You know, people want to send a 2-sentence email. I heard about this great project. I know you're working on it. I support that. Some of the things that people have put in the chat about how important this work is, you know, that's a 5-minute email. That those things really do make a difference at the State House. So we're happy to share that in email address and ask people to help out with that.
That would be
Anybody?
wonderful.
Of course. Any other questions for Jay? Jay, thank you. Thank you so much for being here. And thank you for putting this project together and for your work. I appreciate it. Thank you.
Thank you all so much for having me.
Thank you. All right, I open it up to our members. Does anybody have any updates, things you want to let people know about before we come to an end? No? Any projects, anything in the community we want people to come to or be supportive of?
This is Katrina here. Can you hear me now?
Yes. Yep, I can
Okay.
hear you.
Been having some difficulty. Again, Jay, I put in the chat. Thank you so much. What an important project and so needed. And I just mentioned that it's been something that I tried to implement at the Shattuck for many years with much resistance. So I'll get in touch with you. I have lots of ideas too to add to it, but you are a trailblazer in getting this going. I wanted to thank you, DA Ryan, for being at our Purple Flag ceremony. Your words were unbelievable and so important. And I wanted to mention that our Purple Flags remain up in front of Newton Wellesley Hospital until the 23rd. And so you can still come by there and you can place your own flag for a loved one lost to any substance use at any time on the red flags on the front of our lawn. And thank you all for helping us make this happen.
Thank you, Doctor. All right. Well, thank you all for being here. Again, I am so grateful for the work that everyone is doing. Remember, we are seeing good results in our numbers, and that is really thanks to you. So I look forward to seeing everybody next month. Thank you so much. Bye-bye.
Marion, do you have a second?
Yeah, sure.
Okay. I just wanted to ask you something.
Sure.
Were you aware that it's hard for me to say that someone, I'm sure you're aware that someone died last week at the MBTA station in the morning and
No,
in
where?
Malden at the MBTA.
Oh, yes, I was. Yes.
And you know,
yes.
I was thinking about Jay, you know how many I've heard from a lot of the people that actually went on the T that day that walked by him
Right,
and just had absolutely no idea. And
right,
all I could think of is with Jay, you know, the awareness of having the Narcan there, or maybe being more aware of the surroundings, that this program would be needs to
great.
be done
Yeah.
so
Be
quickly. I
great.
just didn't want to say that with
No, I appreciate you saying that. Thank you.
yeah. So that in itself is a key reminder of how we need this program yesterday.
Yes, we do. We
Yeah,
do.
so that it's a sad reminder, hurts to say, but I'm telling you, and the fact that it was an individual that we were all, he was all known to us, it's just very hard.
Very sad.
And so if they had something like that available, who knows? You know, we weren't there because it was early in the morning. We have our table later in the afternoon, but somebody could have maybe stepped up, you know?
Right. Right.
Okay, my love, I tell you,
All right.
you're in my heart and prayers every day, your team. So
And I
proud
appreciate
of
that.
it.
Thank you. All
Thanks,
right. Take
Hannah.
care. Thanks for
Yep.
coming. Take care.
Bye-bye.
Thank you. Bye-bye.